We're here today to talk about Vanquish, which of course is the standalone non-contact method from BTL for fat sculpting or fat death, if you will, non-invasive body contouring. What we all do know in our practices and what we've seen that's reflected by the statistics is that since 1997, there's been a dramatic increase in the number of non-invasive procedures and technologies that have been adopted all over the world. I think it's a revolution, and that's why people are looking for it, and physician practices have to change with time, and you have to keep up. The numbers are actually startling that even since that time, that surgical procedures, even though they're increasing, non-surgical procedures, non-invasive procedures have increased by 521% since 1997. So I think that tells us that we have to get with it because if we don't have something to offer the patients, then they're going to go elsewhere looking for it. Well, the main part and one of the main focuses of the non-invasive market, of course, is body contouring. And I think that some of the advances have been remarkable, and the fact that we can offer a product such as Vanquish to our consumers is really important. As we noted, 521% increase in non-invasive procedures, and each year it continues to increase on an exponential number. Year over year, again, more and more people come in asking for non-invasive procedures, and Vanquish certainly is being the first non-contact body contouring procedure with no consumables is a valuable addition to anybody's practice. I think that one thing that's really important to say is that not only do we have to offer things, but we have to offer things so that we continue to retain patients in your practice. It's not just getting new patients and attracting new patients. We can all do that, whether it's by advertising, but once you have them, it's patient retention. Because most of the time I talk to my patients and I say, be careful, because once we get our claws into you, we're not going to let you go. So I think the non-invasives are one of the things that we have to be adding, and Vanquish certainly fills the bill for that. Well, what some of the surveys that the Aesthetic Society has put out and a variety of other surveys have shown that about 44% of practices will add a non-invasive body contouring procedure or technology to their practice in the next year or in the next several years. So you have to ask yourself, what are you doing to stay with the current themes? Something that, again, is cost-effective, the patients are asking for, that you can offer your patients that are already in your practice, and you can also attract new patients. Obviously, the longer you've been in this business, or when you're even starting out, if you're looking to attract new patients, you're looking to cross-sell patients. And that's a really important thing, because unfortunately we have become not only the physician, but you are also the CEO of your practice. You're responsible yourself, as well as for having technologies, for understanding what patients are looking for, and again to help them decide if this technology or technique is good for them, if it's what they want, if it can meet their expectations, and again, if it's a cost-effective technology for you to add to your practice. So as I said, I think Vanquish has become a very important part of the non-invasive body contouring space, certainly in my practice and in other practices throughout the United States and actually throughout the world. It is really the first non-contact body contouring device that uses a multiple magnetic fields. It uses this based on impedance matching, where it's using the higher impedance of the fat cells as compared to the skin and subcutaneous tissue, as well as the muscle layers, to selectively target adipocytes and fat cells in the area immediately beneath the skin. It actually will focus about 1 centimeter beneath the surface of the skin, and it focuses these radio frequency waves, and it can hold the temperature at this depth to between 43 and 45 degrees for an extended length of time. There have also been a lot of studies that have been done now that originally are level 4 studies, as well as some level 2 studies, level 3 studies, level 4 and 5 studies that I think have been very good and have shown that you clearly get apoptosis, which is destruction of this cell, of the fat cells, and therefore a permanent change in terms of the circumference of someone and the thickness of the fat layer. The nice part about this is that with this particular technology, Vanquish, there are no disposables, so no additional cost with that. And again, it does not take a physician to be applying the technology. You just need somebody to make sure that it's applied as close as you can to the surface of the skin without touching it, that there are no hot spots, that a medical assistant or even a trained person can monitor the patient, make sure that the positioning of these of the delivery pads are consistent, and that there are no problems with the patient, and therefore it's a more effective use of your time and effective use for patients as well. So what areas can we treat? When you look at the areas, I think the most effective areas for the initial Vanquish applicator was the trunk, mainly in the abdomen, in the hip area, and a lot of that was positioning, and it covers a very, very large area, a huge area of coverage compared to the other technologies out there. Additionally, because it's a non-contact device, you can set these fixed arms over the patient, again just monitoring them for lack of hot spots and comfort, making sure that the machine continues to do what it's supposed to do and there are no problems with it. So the studies, this has been borne out in our practices, that there's almost no issues in terms of complications or adverse events, again, in these patients, which is really important. And the large coverage area and the lack of disposables has really been very, very key. The other thing that has been added, of course, is the Vanquish Flex applicator, which is a thigh applicator. The technology has been very good, and especially for the inner thigh, also getting some coverage of the outer thigh and inferior lateral buttock. We're seeing some nice changes in texture as well as the circumferential changes, but I think that the real advantage is on the inner thigh, which can be a troublesome area if you're doing invasive body contouring in this site. Now, I think the best study that has been done actually came out of Czechoslovakia, where they did the treatment regimen very similar to how we use the technology today, and that is they had 40 patients that they applied the technology to, where they did 4 30-minute sessions, 1 per week, on the trunk, on the central abdomen, and they showed very, very nice results, which you can see on the PowerPoint presentation. The change in circumference that you see after the first treatment, compared to the first treatment, before the first treatment, and then after the 4th treatment. And they took measurements at 1 month after the procedure, and also 2 months afterwards, and showed very, very nice results with an average circumferential loss of 4.93 centimeters circumferentially, with average between 3 centimeters and up to 13 centimeters of loss. Well, let's look at the technology, the science behind it. If you look at, essentially, as we said, multiple magnetic fields are constantly being generated by this device, by the arms of the device. It's a multipolar device, and these magnetic fields are being generated across the treatment area. So multiple positive and negative electrodes are being generated, which will in turn focus the radiofrequency energy selectively on the fat cells. And this is based basically on the impedance of the fat cells compared to, and the fat layer compared to the skin and the layer of the muscle and fascia. If you look at what happens, an internal electrical field has been measured, and it gets continuous impedance feedback, and this electrical intensity, if you will, is measured and fed back and allows this focusing on the fat layer itself. If you look at the tissue selectivity, the fat, as well as it will conduct the energy, the magnetic fields, and the rate of frequency less than the skin and the muscle layer, and therefore the electrical fields that it generates, that the Vanquish machine generates, will be focusing the rate of frequency energy on this level. And you can see in this slide the difference in the conductivity of the tissue of the fat compared to these two other layers. And what it really does, if you look at this diagram, you'll see that the energy is really concentrated about 10 millimeters beneath the surface of the skin, but you'd still get generation of this heat and holding the heat at 5 centimeters or 5 millimeters and 15 millimeters as well. In general, that's about the distance that you're looking to, I think, melt the fat and affect the biggest change down there. And I think what I've seen in my practice is the patients that have a little more tissue, you get more effectiveness. It's the really, really skinny patients with little small areas of fat that we have a little less effectiveness of this technology, because I think that the electrical fields are less focused and there's a little less difference in terms of the impedance because it's such a very small area of this fat. You can see in the thermal profile the very large coverage area of these fixed arms. Really big, and that's different from some of the other technologies that you see out there. As I said, it's a continuous feedback loop. Continuously is changing and adding to in case there's any shifts in the patient's position or anything else. And therefore, you're ensuring that the radiofrequency energy is being focused on the fatty layers. And that's really an incredible step in the technology and effectiveness of Vanquish treatments. As I said, it's a real-time feedback, it's real-time tuning where it's focusing the radiofrequency energy in the fat level and it's delivering the energy to the right level of tissue. As I said, it's really unique, and it's the only non-contact method or technology out there that gives this focusing of the radiofrequency energy and body contouring. As I said, there are a number of studies out there that have been published in peer-reviewed journal, Lasers in Surgery and Medicine, where they actually did one of the earliest studies on the porcine model. They had three pigs that were treated with 4 treatments, 30 minutes each, again at 1 week intervals. They had 10 by 10 centimeter areas that were treated, and they measured the temperatures in the skin, the fat, using thermocouplers, and they found that the skin temperature maintained between 39 and 42 degrees centigrade, which are very tolerable skin temperatures, but that the deeper temperature, the deeper fat, actually held at between 43 and 45 degrees for extended length of time, which is what you're looking for. They also did liver and lung samples at the end of the treatments. And what you see on the graph, that again, that the temperature is being held between, in this case, 44 to 46 degrees for an extended length of time during that 30-minute interval. In fact, it heats up very, very quickly, and it holds that for almost the entire 30-minute interval treatment in this porcine in vivo model. Here you can see the demonstrate apoptosis on the specimens in the fat. And again, the histologic specimens showing dramatic apoptosis after the 4th treatment. A huge amount of disorganization seen and the disruption of the adipocytes in the treatment, or after the 4th treatment on the histologic specimen. And here you can see in the shrinkage, and I think that's a very powerful slide, that not only we now see that there is apoptosis, but you see the clinical difference in the area in the porcine model again. You also see that the hair follicles have been spared, as well as the deep muscle and fascia. So the only treatment that's really, the only area that's been affected that you really see nicely demonstrated is the fat layer. This was also followed up by ultrasonic measuring of the area, and what you see is about a 60% reduction in the thickness of the fat layer in the subcutaneous area in this pig study. Again, the conclusion was that it's a very effective treatment that selectively treats the subcutaneous fat, gives you apoptosis while sparing the skin structures as well as the deeper muscle. Another study nicely done in the March journal Drugs and Dermatology, where they again used the Vanquish machine. This was published again, which I referred to earlier, on the 40 females, 40 patients, 36 females, 4 males. showing an age range between 18 and 68 years. They again had 4 30-minute treatments 1 week apart and did the circumferential measurements as well as baseline photographs taken at baseline and 4 weeks after the final treatment. They also did self-evaluation as well as evaluation from the physicians after this was performed. Again, this treatment regimen is about 15 minutes shorter than we currently have decided that our treatment regimen is. We recommend 4 one-week treatments or 4 45-minute treatments at 1 week apart. I believe when you look at this, of course, in 30 patients or 35 patients out of the 40 completed the study. 30 had a decrease in circumference ranging from 1 centimeter to 13 centimeters with an average of 4.93 centimeters. I do think that if they had followed up for another 2 months after, so 3 months after the last treatment, then the circumferential measurements would have been more improved even after this point. There were, in this case, what were called 5 patients that were non-responders, and that was probably due to the selection process. Again, I think you're a little more effective in the patients with a little more adipose tissue in the trunk area. Very high patient satisfaction, very well tolerated. 90% or more of patients reported 0 discomfort. I again think as with these studies and further treatment that we're improving the delivery so that we really don't have patients that have any adverse effects that we've seen. In this study, they had 1 subject with paniculitis, which resolved at 3 weeks, and 1 area that had mild to moderate erythema, which resolved within 60 minutes. Another peer-reviewed journal paper, again, Journal of Drugs and Dermatology, JDD, by Key, showed that with Vanquish treatment that, again, using thermal optical fibers at 1 centimeter and 2 centimeters deep, that you can see that the temperature was held at about 43 degrees or more for a prolonged period of time. I think that that shows, again, that the impedance matching and the focusing of the radiofrequency energy by these magnetic fields really will focus it at the 1 and 2 centimeter depth, or that area in between that. You can see a little bit of difference, and that's why I think the optimal focusing is at about 1 centimeter depth. Again, more studies showing 15 minutes of thermal exposure at 43 to 45 degrees shows not only the initial delayed cellular apoptosis, but you do have a delayed phenomena that was noted even 9 days after the initial procedure in patients that underwent Vanquish contouring. What you do see, which is important with this, is that if you damage the cell membrane, that the normal cell turnover will then take some of the cells that were damaged and also cause further turnover of these cells. And that's why we say that you continue to improve at a time after this initial treatment. Some of those adipocytes that have some damage will turn over on their own after that. And again, the skin surface that you can see, temperature maintained in this study at about 40 degrees centigrade, which is very tolerable. After treatment, the maintenance of the elevated temperature in the adipose layer, however, stayed for a good 30 minutes after the treatment itself. And I think that is actually, if you look at the next paper by David McDaniel and Paula Lozanova, hopefully I didn't say the name wrong, which actually took biopsies from 2 female subjects in their abdominal skin immediately after they had Vanquish treatments, or they were treated, and then they had the biopsy 1 hour post-treatment. They also used infrared imaging to monitor the skin surface temperature, and they had thermocoupling devices at 1 and 2 centimeters to look at the amount of heat that was generated. And what you can see is a significant apoptotic index of 487% that was changed during this treatment. And this, again, is 1 hour. The specimens were taken 1 hour after the end of the treatment regimen. The thermal camera also showed that the skin was maintained an average service temperature of 39.2 degrees after treatment, which is very tolerable. And at 1 centimeter, the initial temperature is 40 degrees, but it reached a maximum of 45 degrees 15 minutes after the initiation of treatment, and it remained stable for the remaining 30 minutes of treatment time. So this again showed a peak elevation of temperature of 45 degrees in the subcutaneous fat with maintenance of a very tolerable skin temperature during the treatment. Here you can see it's just the before and afters of several of patients that were done in a variety of centers. Okay, so we're going to, if you go through some of those pre and post procedure pictures or post-Vanquish procedures, you can look and see in some of the polls that patients are very happy with it. 73% say that Vanquish was worth it compared to other technologies. I think that, again, without the fixed costs, without any disposable costs, that it's a very easy technology to integrate into your practice and a very high patient satisfaction rate. As we improve our counseling and make sure that we're selecting the patients right and that they have the proper expectations, that's when your patient satisfaction will increase. All right, just you can see looking down at return of investment, again, these things are very important. Some of these studies will show how quickly you can get a nice return of investment. Again, the advantage that we now have peer-reviewed studies published in peer-reviewed journals that show the apoptosis, show the effectiveness, the treatment time, and the lack of medical personnel that you have to devote to integrating this technology in your practice, as well as the lack of disposables, makes it very attractive technology to look at. Again, once you have the machine, I think that it pays for itself very quickly. They have come up, if you look at the slide where you look at the different monthly cash flows, because again, not everybody has the patients in your practice. You have to decide if you're going to do external marketing as well as internal marketing, which is really important, not only to cross-market your patients, but again, capture your already patient population that you have. And you can see, based on even as low as $1,500 a month, which would actually be much less than you charge per patient, you would actually recover your investment in 5 years. We got to assume that you're going to bring in more than half a patient per month. So I think that the net cash flow, it can be anywhere early on from $5,000 to $10,000 per month. But even if you bring in just under $10,000 a month in terms of cash flow, your break-even point becomes 8 months, and that's pretty darn good. I think in summary, it's a very well-established company that gives good support. There is evidence-based mechanism of action that we've seen. It's really the first non-contact body contouring device that really requires very little staff effort and training to integrate in your practice. Optimal and continuous real-time impedance feedback with the magnetic fields that are being generated to focus this radio frequency energy. Thanks for your attention. I can't believe I got that all out. I think there's a lot of good information there. The company BTL has been very responsive to our needs and will continue to, I think, add to this realm of non-invasive body contouring. Thank you.